How does urinating after sex stop E. coli UTIs? Imagine a simple habit that can make a big difference in preventing urinary tract infections. That habit is urinating shortly after sex. When you urinate after sexual activity, it helps flush out bacteria that might have entered your urinary tract during intimacy. The bacteria most often involved in urinary tract infections are Escherichia coli, or E. coli, which naturally live in the intestines and around the anus. Because the female urethra is shorter and closer to these areas, bacteria can easily transfer from the anus or vagina into the urethra during sex. Urination acts like a natural cleaning process. When you pee, the flow of urine pushes bacteria out of the urethra before they have a chance to travel further into the bladder. While urine itself does not kill bacteria, the mechanical flushing reduces the number of bacteria that can cling to the lining of the urinary tract. This is why healthcare professionals often recommend urinating within about 15 to 30 minutes after sex, especially for women, to lower the risk of developing a urinary tract infection. Since women have a shorter urethra than men, bacteria have a shorter distance to travel to reach the bladder, making postcoital urination particularly important for women. Men have a longer urethra, so bacteria are less likely to reach the bladder quickly, but urinating after sex is still beneficial and harmless. Additional steps to prevent UTIs include wiping from front to back after urination to prevent bacteria from the anal area from reaching the urethra, staying well hydrated to promote frequent urination, and avoiding irritants like scented feminine hygiene products that can increase infection risk. From a bladder health perspective, preventing infections is vital because recurrent UTIs can cause ongoing inflammation of the bladder lining. Chronic inflammation may lead to bladder irritation and, over time, could contribute to changes in bladder tissue. Therefore, simple habits like urinating after sex support overall bladder health by helping to prevent infections and reduce inflammation. It's important to remember that urinating after sex is a helpful preventive measure but not a foolproof guarantee against UTIs. If you find yourself experiencing frequent or severe infections, it's best to consult a healthcare professional. They can evaluate your situation, provide personalized advice, and recommend appropriate treatments to protect your bladder health. Always prioritize medical guidance to ensure you're taking the best steps for your individual needs.